views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of Bronxnet or the program underwriters.
Welcome to Public Health America, a weekly program produced by Bronxnet in partnership with Mercy College. I'm your host, Dr. William Latimer. Here on Public Health America, we speak with experts from an array of specialties across the liberal arts and health professions to provide you with not only the best science, but practical tips to live a healthier life. We also celebrate what studies have long documented, namely the unparalleled value of a liberal arts college education by setting the stage to pursue a career of your choice, increase lifetime earnings, and engage in civil debate. Our experts will share decisions they made and support they received that helped them to beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. It is my pleasure to be here today with Dr. Adrian Aguilera, Associate Professor in the School of Social Welfare at UC Berkeley. Adrian, I know you've been doing some really important work on technology-based interventions to address health disparities. Tell us a little bit about your work.
Yeah, thanks for having me on. So we started work using text messaging to try to improve mental health care. And what we started off doing was adding text messaging to ongoing group cognitive behavioral therapy for depression. So folks go into therapy to work on improving their depression symptoms, and we send them automated text messages during the week to help track their mood and remind them of the skills that we talked about in session. And the idea was to increase engagement with the therapy. One of the challenges that folks have is getting into starting therapy but not continuing it. And we found that adding text messages pretty much doubled the number of sessions that people attended. So made the treatment more powerful. We've since kind of moved on to also do other text messaging related projects. We're doing one to try to help encourage folks to stay more physically active by sending them motivators and trying to personalize those messages based on what works best for them, using some kind of personalization, machine learning methods kind of on the back end. But the idea is to try to improve motivation.
That's great. I mean, but let me ask you a couple of questions. So you're applying these technology-based methods through text messaging to reduce health disparities. So I presume, but you tell me, are you working with underserved populations or populations that tend to have less access to healthcare, and or are you applying this across a wider swath of populations? Who's the target audience? Is that fair?
Yeah, that's a great question. The focus of our work is always on underserved populations, as we call them, vulnerable populations. There's a lot of terms. The idea is folks that don't necessarily have a lot of resources and or are receiving services in the public sector, so at public clinics, things like that. A large portion of our participants are Spanish speakers as well. And this is important because there aren't that many interventions or resources in Spanish, and much less when we start thinking about technology-based interventions. And one of the broad areas of focus is as we start to develop more technology-based interventions, one of the concerns that I have is that we could possibly make health disparities worse if only certain people have access to these new innovations. So our work is trying to make sure that we're developing with and for those who are marginalized, sometimes left out, so that they can be folded in and ideally help close some of those disparities that exist.
Sure, and you kind of addressed where I was going to go to a large degree, but I want to go a little bit further down that path because I think it's so important. You're in California, here in the Bronx, I'll just use one example. We have, lower rates of vaccine uptake, and we've had several guests on the program that have discussed a sort of historical distrust of the medical profession among many folks in the Bronx, and many of them are Spanish speaking. And then the other issue, which has not as much to do with distrust, is just there aren't that many providers, not nearly enough, that are Spanish speaking. And there are plenty of, parents of college kids and adults generally that their primary language is Spanish. So
Right.
are these text messages in Spanish?
Yeah.
Is it specifically, so like, to what extent is that relevant to the efficacy of what you're doing?
Yeah, so we do aim to develop all the projects that we do them in English and Spanish to try to provide a wide reach. And that Spanish is a particular area of focus because, as you mentioned, there's so few providers relative to the need that we need resources. We need more people doing individual work, group work, but we also need resources that are technology based in order to address the need. That is definitely there. And then related to kind of the first comment that you made about working with diverse communities and the relationship between kind of healthcare, is I think you're right that a lot of it has to do with trust, right? And folks engage when they trust their providers, when they trust the health system. And that's when there will start to be kind of movement, integration, engagement, et cetera. So that's something that we need to focus on because we know that simply telling somebody what to do has its limits.
Sure, no question. So in terms of access, it just seems to me that it's perhaps common sense in a good way that using text messages on phones is absolutely a way to reach a much wider audience that might not access healthcare. What about, and I don't want to, I want to phrase this carefully, meaning I don't want to make it ageist. I simply want to say, what about folks that don't have a lot of access to cell phones? Like, I could imagine a subpopulation of a population that might, not just pick up their cell phones and go boop, boop, boop the way, someone from 20 to you pick the number would do. Is that a factor at all?
Yeah, I mean, it definitely can be a factor, but it comes down to implementation. So what we found, for example, in the work that we've done, our average age of the folks that we've worked with in our interventions that are a part of clinical care is about in the mid-50s. So that's not the 20-year-old that's out there looking for an app necessarily. So we're bringing the technology to people. And the good thing is that, in this day and age, almost everybody has access to a phone. They may not be able to use all the features, but they have the access to the phone. So if we develop a technology in a usable way that's straightforward, we can sit down with folks and teach them how you respond to a text message and how to do use some basic features that help them engage in an intervention that we've developed. That has them in mind.
How do you get, how do you engage them, a prospective participant, patient, person, the first time? How do they find out about this great opportunity?
So it's usually through their providers. So in the first example of the group therapy, it's folks who are coming to therapy anyway. So once they're there, we then offer them this kind of additional service on top of what they're already getting. And that's when we do a little bit of an orientation. We talk to them about the purpose of it. And we do a little bit of teaching if they're not as comfortable. More and more people are becoming comfortable. And interestingly enough, the people that have learned to, for example, text as a result of the study and have told us that that was one of the best aspects of it, that now they could communicate, for example, with their grandkids or with their kids
right.
In ways that they hadn't before. And some also mentioned that, family members aren't always the most patient when they're trying to teach each other technology. So having kind of this third neutral party provides that role as well. And I think that this is becoming more and more important because technology is happening, right? If anything, the pandemic has taught us that technology is here to stay in one form or another. And it's really important for us to teach, to make that part of healthcare, to teach people how to use the technologies that are becoming an integral part of the way we provide healthcare in this country.
Sure. I could certainly imagine a world where, a deliberate intervention to increase access to healthcare among underserved populations would subsequently lead to just better quality of life because they could talk to their grandkids more. I mean, like that would be, I could easily see that being almost as important an impact as, their access to healthcare. And that is in no way to minimize the significance of that. What do you see as next steps in this great program of research?
Yeah, so we're constantly thinking of ways that we can address need. So one of the areas that we're thinking of is addressing the mental health needs of Spanish speakers, thinking about how to do more, let's say, develop and provide apps for people to help improve their mood, but then also providing them support while they're doing this. So we need to find ways to blend the technology with the human interaction. It's simply not possible, especially with the current resources that we have, to provide, let's say, one-on-one mental health care to everyone who needs it, especially if you're a Spanish speaker. We need to move towards that goal, train more people, but at the same time, we need to develop other innovative methods where we can utilize, let's say, some technology, some human interaction, and blend those two as needed for people. And so we keep moving in that direction as much as possible.
That's great. Fantastic program of research. We're going to take a quick break. When we return, Dr. Aguilera will tell us a little bit about his life story and what helped him to succeed in college and how that set the table for the great work he's doing today. Take care. We'll be back. Public Health America. Welcome back to Public Health America. I'm your host, Dr. William Latimer. So in this part of the segment, I always begin, Adrian, with the same question, which is, where were you born and what were some of your formative experiences?
Great. So I was born in Chicago. And I think it's important to state before that, my oldest siblings and my parents were born in Mexico. So they immigrated to Chicago. I grew up in a predominantly Mexican neighborhood, kind of very low income, working folks. And the neighborhood had very much a sense of community. But there were a lot of problems going on. There was gang violence, poverty, etc. Those are all things that I kind of noticed, paid attention to, and have influenced kind of the way that I started thinking about mental health, especially observing some of the way mental health challenges impacted my own family. And that kind of served as the initial motivation to kind of put all this together and figure out what I could do, what I could learn to try to address these issues.
That's great. So your parents emigrated from Mexico, landed in Chicago, that's where you were born. Tell me a little bit about like school, elementary, high school, etc., public, private, what was your experience? What were some, were there challenges? Were there some positive things? What was that era like?
Yeah, so my parents struggled to make ends meet, but they really valued education, and they made sure to put myself and my 5 brothers, 6 boys in total, through Catholic school. So I went to Catholic school in Chicago, kind of a lot of emphasis on discipline and so on. But I think I realized, early on that I enjoyed school. I enjoyed learning. I enjoyed the process. Then went off to high school, also a Catholic school. It was very service oriented. And I think that matched on very well to kind of bridging kind of some of the intellectual pursuits, learning, but then kind of what is the purpose of that? And so that started to solidify, started doing some volunteer service in the community, and a lot of the learning by seeing, by getting in the middle of things.
That's great. And so as you neared the end of your high school career, what were the discussions that were going on either in your own mind or with your family or with people in your high school in terms of whether or not to go to college and what your options were?
Yeah, that's so I kind of knew I wanted to go to college. I think the question was where. I think in my school, people didn't really leave Chicago, and I mostly applied near there, but I also applied to Stanford University. I'd heard about it in a magazine somewhere, thought it looked cool. So applied to a variety of places, ended up getting into Stanford, but really struggling with the decision of leaving. It's pretty far away from Chicago. And for a minute, I was scared enough to potentially want to stay in Chicago, but listened to my elders, which is something I've continued to do through my career, and went ahead with that decision. And it's been one of the best decisions I've ever made. It really helped me grow. It was extremely difficult. I don't think I was as prepared as my peers, but kept pushing and kept learning, and things have gone fairly well since then.
That's great. I mean, obviously, Stanford's one of the greatest institutions in the world, let alone the country. What were there some key mentors, or what was your major? Did you know what you wanted to major in? Was that a journey? Just what was that experience like?
Yeah, I think since I had seen kind of the personal challenges of mental health in my own family, studying psychology was always something of interest. And I went to Stanford kind of with that in mind, wanting to be a psychology major. I also knew that you had to get a doctorate to be a psychologist. And that was scary. It didn't seem like a reality, but I got involved in research, had some really great mentors who essentially told me that I had to apply to graduate school, and I listened. And I think that I've really taken that lesson throughout, is to seek advice and to take it. There's a lot of wisdom in those who have come before us, and it's really, really important to seek it out and put it into practice.
That's great. I mean, the one comment that I'll make, just to contextualize, we've had several guests, most guests, quite a few guests, have had an anecdote, thankfully, of a really wise and intelligent person who said to them, "You can do this," when maybe they didn't themselves have a roadmap to do it, and then they ultimately did it. But I think it's also important to say that we've had some guests that have said earlier in their careers, they had some folks tell them that they couldn't do it. And their message was, don't listen to them. So I just am going to put that out there as not a counterpoint, but just another important point. So you went to Stanford, you got your bachelor's. Where did you go from there?
And just to follow up on that point, I think you're right on. I think I've had some of those moments and I've used those as motivation. And at the same time, tried to listen to, balance out those others. So I went off to, I worked for a couple of years to get more research experience, listening to a mentor again, and then went off to UCLA, got my doctorate in clinical psychology. And interestingly, even once I got there, I knew I could get a master's, and I was like, well, if this doesn't work out, I can get a master's and do something else. Or if a research career doesn't work out, I can do clinical work or do something else. But I've just kind of kept chugging forward until somebody told me no. And to this point, they still haven't told me no, so I keep forging ahead.
That's great. So you went from Stanford and then did your PhD at UCLA in clinical psychology. I'm assuming after that you did, where'd you do your internship?
So I did my internship at the San Francisco VA. I wanted to come up to San Francisco. I had spent some time in the Bay Area, and I wanted to work at the General Hospital at UCSF for my postdoc, for internship and postdoc. I didn't get accepted into that internship program, but again, used it as motivation, and I kept contacting a mentor there, Ricardo Munoz, and I ended up doing a postdoc there with him. So I think persistence has been another theme of just, identifying some goals and continuing to try. And I think, particularly for, folks earlier in their careers and students, the importance of persistence is something to always keep in mind. I get emails from students, and frankly, I am busy and it's hard. Some of those things fall through the crack. But if I get 2 emails from a student, I pay attention and I almost always respond, and we can always connect. So not always taking the first no as a definitive no. We can, if it's something you really want, if you ask again, if you keep trying, you will learn in the process, and you will show that you're committed, and that means a lot.
Sure. Not many of our guests have talked about, nor have I asked them about their postdoc experiences. When I ran a T32 at Johns Hopkins with postdocs and predocs, it wasn't uncommon that really smart young people of all variety of imaginable backgrounds really wanted to kind of get out and get done. And I mean, it wasn't unusual for me to say, that's fine, that's good, but if you stay and you publish a few more papers, you might be in a little bit better position when you do make that move. Talk a little bit about your postdoc experience and how that was instrumental in sort of setting up the next step.
Yeah, the postdoc was great because I actually ended up doing something different than what I did in graduate school. In graduate school, I was studying schizophrenia, cultural factors, things that were very interesting, but not what I wanted to do long term. I knew I wanted to move into studying depression interventions. And in talking with my mentor, Ricardo Munoz, started developing the technology-based interventions that have become the basis for what I'm doing today. And that served as a time for me to really just focus on developing these things, as you mentioned, on publishing, and not having to worry about, in academia, the kind of tenure clock starting and feeling the pressure of, accumulating enough work before going on to the next level. So it was, particularly when you look back, it was so nice to have that space to just do research and almost nothing else.
Sure. So we just have about a half minute left. If you were to give advice to a young person or a person of any age about the possibility of going to college and what that might mean for them, what advice would you give?
I think persist. Persist is the most important thing. I think, lack of confidence is the biggest barrier. It's not ability. And confidence gets built by experiencing success. Success happens by continuing to persist.
That's great. I want to thank you. I want to thank our guest, Dr. Aguilera. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. See you next time on Public Health America.